Are you already on Wikisana, the biggest search engine in holistic medicine? Then I recommend you to look it up.
Hello and welcome to the Natural Medicine format. Nice to have you back. Today we are talking about the so-called toxopheresis and how a very successful treatment of macular degeneration has been achieved. Of course, toxopheresis can also be used in many other diseases. I would like to talk about this with my guests today. Stay tuned, we'll start the conversation in a moment. Welcome everyone. I have 3 guests here today. I'll start with you, dear Dr. Med Harald Burgard. You are a specialist in internal medicine. Welcome.
Hello, Alexandra. I'm glad to be here.
Michael Husung is sitting next to me. You are the managing director of the company Medica in Germany and co-founder and eye of the company MedSelect.
Yes, thank you very much.
And finally, last but not least, here on the screen, welcome Dr. Med Stefan Trapp, eye doctor. You have to say that he is a holistic eye doctor and a clinical environmentalist. Welcome to this point.
Yes, thank you very much for the invitation.
Nice that you took the time. We have already talked about the concept of the company MedSelect in an earlier conversation. And at some point you also opened up to the idea of toxopheresis. Can you maybe briefly describe how you came up with this idea and why you included this treatment method in your concept?
Yes. First of all, I'll be brief about myself. I am an eye doctor in a private medical practice. And we holistic here. That means it's about preventive medicine above all. Of course, we now have all kinds of chronically ill patients here. It's more or less about prevention, but rather about damage reduction, depending on how advanced some diseases are. As an eye doctor, of course, I was hoping to get special therapy options into my hands so that I can treat all these chronic eye diseases. Because, for example, macular degeneration, which is treated by intraventricular injections as a guideline in conventional medicine, and where the patients then also carry massive damage from it despite the therapy up to blindness, somehow led me to ask what could be done to prevent something like that.
Trotz der Therapie massive Schäden davon tragen bis zur Erblindung, haben mich dazu geführt, irgendwie zu erfragen, was man denn machen könnte, letztlich sowas zu unterbinden, zu verhindern.
And we have been treating macular degeneration patients here for almost 10 years now. More or less successfully, to begin with the therapy options we were given. We were able to make significant progress with the therapy methods we had until a certain point. But we were never able to reach the right turning point. And we reached the right turning point after introducing the toxopheresis. So we had therapy options such as intravenous infusions and oxygen therapies and ozone therapies and magnetic field therapies as part of a holistic therapy regime.
Und Sauerstofftherapien und Ozontherapien und Magnetfeldtherapien im Rahmen eines ganzheitlichen Therapieregimes.
But in the end, we were only able to help the patient on a small scale and up to a point where we were able to stop macular degeneration, for example.
Geringfügig weiterhelfen und bis zu einem Punkt therapieren, wo wir die Makulardegeneration zum Beispiel stoppen konnten.
But we were never able to bring anything back, to push it into remission. And we observed that with the introduction of the toxopheresis, i.e. the therapeutic apheresis, and as a further therapy module within the framework of a holistic therapy concept.
First of all, I think it's great that you as a doctor are simply trying to find a solution, a sustainable solution, or even a remission for diseases that are hard to treat. In this context, with macular degeneration, you have kindly prepared a practical case from a patient and documented it a bit. And we are now happy if you would like to explain and present this practical case in a bit of detail.
Yes, exactly. As you just said, it's about a more or less spectacular case. Spectacular because we know that from the toxopheresis, need several therapy sessions for moist macular degeneration, until a satisfactory therapy result is achieved. And in this case it was the case that the patient, who did her therapy in a renowned clinic in Bonn, cancelled that one, where she received several intravitreal medication application series to repress the moist macular degeneration with swelling in the macula.
Um die feuchte Makulardegeneration mit der Schwellung in der Makula zurückzudrängen.
She cancelled that and then came to us with the request that we practically and exclusively try to solve this problem with alternative therapy methods.
Mit alternativen Therapiemethoden versuchen, dieses Problem zu beheben.
Yes, and my wish was actually that we drive a complementary medical therapy track, namely both that we first continue with the intravitreal injections to gain time, to ultimately help out with the therapy methods that we are still using here.
Zeit zu gewinnen, letztlich mit den Therapiemethoden, die wir hier noch zusätzlich anwenden, den Spieß umzudrehen.
But the patient herself insisted that we treat exclusively with alternative medicine, so of course we went over to first determine a few laboratory parameters to see what else was going on with the patient.
Zunächst erstmal ein paar Laborparameter zu bestimmen, zu gucken, was bei der Patientin sonst denn überhaupt vorliegt.
And after we carried out a detailed environmental medical first analysis, there were numerous diagnoses.
Da zeigten sich wesentliche, also zahlreiche Diagnosen.
So it's about an 87-year-old patient, who first presented to us in 2018 the medical purpose of a clinical environmental analysis. And the following diagnoses came out, that she had a neovascular AMD with systemic macular edema. This means that she has a moist macular degeneration, in which new vessels from the choroid grow into the retina and lead to degenerative changes in the retina.
Aus der Aderhaut quasi in die Netzhaut einwachsen und zu degenerativen Veränderungen in der Netzhautmitte führen.
The macula, that is the retinal center, that is the area of the sharp optic nerve, where ultimately the sensory cells, i.e. the photoreceptors, are particularly densely arranged.
Letztlich die Sinneszellen, also die Photorezeptoren, besonders dicht angeordnet sind.
About 95% of the optic nerve goes through this macula. And of course you can imagine, if the macula degenerates, i.e. if it breaks down, through such processes, through such disease processes, then the patients become centrally blind. Or they become blind centrally. And because of this treatment, as I said, she was treated in a renowned clinic in Bonn. And at certain intervals, time intervals, she was given intravitreal injections again and again. This means injection of medication into the glass body. These are drugs that used to be used as a chemotherapeutic in colorectal carcinoma, i.e. in large intestine tumors. And in the treatment of such patients, it also occurred at the time that if you treat them in this way, i.e. by means of this chemotherapeutic, then the macular degeneration, the moist macular degeneration in patients who also have a colorectal carcinoma, at the same time recreated. That is why it was decided to inject this type of medication directly into the glass body. But of course that has disadvantages, which I will comment on again in a moment. Then the other diagnoses were that she had retinal drosses. Retinal drosses are small waste packages that, when you look into the eyes, i.e. fundoscopies the retina, i.e. makes an eye background examination, you can see it. You can see it because the retina is transparent. And that's why you can see cell metabolism deposition directly in the eye. And you can only see that in the eye and actually nowhere else. I'll show you what it looks like. If you look at the pictures, this is a so-called fundoscopy, i.e. a picture taken by means of a special camera from the eye background.
Mittels einer speziellen Kamera vom Augenhintergrund geschossen.
And then we see these white deposits here.
Ablagerungen hier.
And these are all drosses, so-called small waste packages.
Kleine Müllpakete.
And you can see that in these recordings, but not so well. It doesn't come across so well, also in the area of the macula on both eyes. Then she had numerous problems with the eyes and the most diverse diagnoses. And the main diagnosis was the neurovascular AMD. AMD stands for age-associated macular degeneration. And age-associated is always a bit unfortunate, because we see that these degenerative forms also occur in increasingly younger ages. And we also have 35-year-old patients who suffer from a so-called AMD. That was the main problem, why she came to us. The other problem was that she also grew a membrane on the retina surface, which ultimately also has contractile elements. This is called epiretinal glyos, which then contracts on the surface and ultimately ensures that fluid also pulls back. And that is also why a macular edema, i.e. a swelling in the area of the central retina, is caused. In addition, she had retinal vessel changes. Retinal vessel changes are very important. We can directly assess the vessel status in the eye. We are a bit ahead of the other colleagues, because you can only observe vessels directly in the eye. And retinal vessels are like a window for the entire vessel tree. And if you have changes there, then you can assume that the entire vessel tree of the patient is also affected. With retinal vessel changes, we then assess vessels that contract, that cross, and also show the caliber fluctuation. Caliber fluctuations are an irregular thickness in the course of the vessel. And these retinal vessel changes can of course again indicate that there are vessel calcification processes. Infectious changes occur in the vessels and there are also vessel wall hardening. And we know that ultimately the health of a body stands and falls with the vessels. That is, depending on the quality of the vessels, the patient is less or more healthy. The second biggest problem that the patient had was a chronic open-angle glaucoma. This is a form in which the pressure in the eyes rises to such an extent that ultimately under the increased pressure in the eyes and the microcirculation that is caused by it, the nerve fibers permanently die off and lead to a constricted facial field. Of course, this was immediately treated here, but that's not what it's about today in the first place. It is primarily about the neurovascular AMD that she had on the left eye. After several IVM therapy series in this clinic, this swelling returned again and again. A cystic swelling in the center of the retina. This frustrated the patient so much that she abandoned this therapy and sought help from us. Further diagnoses were of course in connection with this chronic open-angle glaucoma. The papilla is the optic nerve head. That is, if you look into the eye, the retina in the eye background, you can also see the optic nerve head. We call that the papilla in medicine. Of course, it becomes pale because it is first of all badly circulated. Increasingly, more nerve fibers die off and the color of the optic nerve head changes as a result. She had keratoconum depictis sicca, that means dry eyes. Dr. Eyes are ultimately only a symptom and show that the secretion-producing gland in the eye produce worse. This is always the case when chronic inflammation in the body or the hormone balance is no longer good. With an 87-year-old patient, you can imagine that the hormone balance is no longer the same as it was when she was 20 or 30. In particular, the chronic inflammation that the whole body was affected by led to the patient's eyes becoming significantly drier. As part of the first anamnesis conversation, further anamnesis was also discovered. The patient suffered from massive hypertonia, which was prescribed in threefold therapy. She suffered from heart rhythm disorders and significant fatigue. She hardly had the strength to get out of bed and finally get into practice. After a heavy metal provocation session, we could also find that the patient suffered from a significant multiple chronic heavy metal strain. In particular, aluminum, lead and mercury were massively increased in her case. In particular, there was a massive histamine intolerance. This means that she had a problem with histamine. Histamine is an inflammatory substance that can be liberalized in the body as part of the inflammatory processes of special immune cells. It can also be absorbed by food. If the patient has a problem with the degeneration of this inflammatory substance, which she also had and which could also be detected, this histamine accumulates and causes chronic systemic inflammation. This is especially difficult in a neurovascular macular degeneration. Histamine also leads to an increased permeability, i.e. permeability for water. This leads to increased fluid flow into the macula and to an increase in the macular edema. Then we switched to doing a little lab. The patient was not always so willing to have so much blood taken. With what we did, it was primarily about understanding whether she had chronic inflammation or not. That's why we ran an inflammation profile with a well-known German lab. It could be determined that she actually suffered from significant systemic inflammation, i.e. inflammation that affects the whole body. We were able to determine that the TNF-alpha values, i.e. interleukin-6 and interleukin-8 values, i.e. special pro-inflammatory inflammatory substances, were massively increased. She also suffered from a reduced intracellular ATP production. This clearly indicated a cell metabolism disorder and partly justified her chronic fatigue syndrome. The patient was not willing to do more labs. We were able to order a few more vitamins. She had deficiencies in B1, B6 and B12. I forgot to write that in the diagnosis. She suffered from a slight anemia. First of all, for the viewers, so that we know what we are talking about. Again and again the term macula has fallen. First of all, we have to clarify what the macula is. If we look at the eye here, then the reddish part is the retina. The small incision is the macula, the central part of the macula. Macula also means the yellow spot. Yellow spot because there are a lot of carotenoids in the area of the retina. Carotenoids like vitamin A, beta-carotene, zeaxanthin. These are all substances that ensure that the sensory cells are protected from phototoxic stress, UV light and blue light, the resulting oxidative stress in the cells. The formation of radicals in cell metabolism can also be buffered, among other things. In macular degeneration, this area of the retina dies. The retina consists of different layers. If we look at the picture from the inside to the outside, we have the nerve fiber layer at the top, then the other layers, and finally the pigment epithelium. This is the outer blood retina barrier, something like a filter. This filter only allows certain substances to pass through to the retinal cells. On the other hand, it ensures that slags that form during cell metabolism can be transported in the area of the sensory cells, in the direction of the choroid and lymphs. In most cases, degeneration occurs in the area of the pigment epithelial cells. Due to various factors, a cell metabolism disorder occurs in the area of the pigment epithelial cells. Due to the cell metabolism disorder, certain waste products are created, which are extracted from the cells and stored in the cell intervertebral tissue. As small waste polymers, they spread between the cells. These waste polymers are called doctoses. In this state, when it becomes more and more, what you see here, doctoses, the metabolism situation also for the downstream sensory cells. If the pigment epithelial cells no longer function properly, they can neither transport the slags nor let enough oxygen and nutrients through to the sensory cells. As a result, blockages arise here. Overacidification occurs and chronically inflammatory processes are generated, which ultimately lead to the destruction of pigment epithelial cells. We are already at degeneration. If, however, the pigment epithelial cells break down, the sensory cells associated with them degenerate, so that the retina begins to be destroyed in the area of the sharp vision. The more of these sensory cells die off, the worse the central visual field is. At some point, they only look pixelated or nothing at all, if everything is scarred and neither sensory cells nor pigment epithelial cells are present. This is the case with a dry form. The tissue degenerates without new vessels growing in there. Then there is the second form. This is the wet form, the so-called exudative or neovascular AMD. This actually leads to the growth of vessels from the vein through the pigment epithelium into the neural retina. This always happens when these cells get growth stimuli, i.e. the endothelial cells, which are cells that represent the vessel lining, to grow. Endothelzellen sind Zellen letztlich, die die Gefäßauskleidung von Gefäßen darstellen, Wachstumsanreize bekommen, zu wachsen. This always happens when signals and substances are ejected as part of a degenerative process of cells that suffer from a hypoxic state, i.e. when the cells get too little oxygen. Hypoxischen Zustand leiden. Das heißt, wenn die Zellen quasi zu wenig Sauerstoff bekommen. But it's not just that. There are often cells that have enough oxygen and send these signals and substances anyway. This happens under certain circumstances when the cell metabolism is so disturbed, because the mitochondria, our cell forces in the cells, are so degenerated that the oxygen in the cells cannot be used at all for the production of energy. Der Sauerstoff, der in den Zellen ist, gar nicht verwertet werden kann für die Herstellung von Energie. So under a certain process, the so-called Varro process, the cell switches to a fermentation metabolism. With this metabolism, more slags and, above all, lactate, which significantly worsens the situation locally. So if growth factors are now released from certain cells, because they have the feeling of suffocation, then this naturally leads to the fact that new vessels can grow.
Das Gefühl haben zu ersticken, dann führt das dazu natürlich in der unterliegenden Aderhaut dazu, dass neue Gefäße wachsen können.
This is also often the case with tumor genesis.
Bei der Tumorgenese der Fall oftmals.
So growth factors ensure that new vessels can grow into the tumor. The same thing happens now with the wet form of macular degeneration.
Dr. Trapp, I just have to ask you to speed up the whole thing a bit. You're doing a great job, and I think it's great to learn about it in such detail. Only time is running out for us a little bit.
Okay, so that patients have an understanding of what we're talking about. There are two forms of macular degeneration, dry and wet macular degeneration. The patient came to us with the second version, with this form down here, with the wet version. Then she asked us that we only treat alternative medicine there. As a therapeutic first measure, we carried out an apheresis directly. We can show that here in the picture. She came here from the hospital after she had been given injections with a preservative on the left eye. She got the first apheresis on October 16, 2018. And immediately it was remediated. It was as if nothing had happened. And that was spectacular in this case. Because normally we only see something like this when we have carried out several apheresis in combination with other therapy options, which we then add synergistically. We did an apheresis. We couldn't trust what we saw in our own eyes. That was the state after the apheresis. Without having carried out any other therapies on the patient before, we then did another apheresis to stabilize the state. But the patient could not do it in the meantime because she was prevented. The second apheresis was done 4 months later. And a third apheresis was switched on 5 months later. And with that we were able to consolidate the state to this day. So there was no more relapse. The patient is doing well. The vision power has increased significantly again. In the meantime, it went down to 0.3 to 30%. And now it is between 60 and 70%. Stable.
That's really sensational, especially when you consider that the patient is 87 years old.
The patient is 87 years old and is very healthy. In addition to the main problem that existed with regard to the neovascular APD, which we have completely treated, also the side diagnoses are being treated. Let's take a look at the eye. I'll show you how the patient came to us. She came to us in 2018. This is now the right eye. With such a redness. She had it for 3 years. The eye was massively hyperhemic. Increased blood circulation in the area of the conjunctival vessels. And she had a sicker pillow down here. And ultimately the eye could no longer be pulled out of this irritable state. She had received local antibiotics several times. Steroids. So cortisone. And then it got a little better. Then the redness came back. And then even stronger. After the first apheresis it looked like this. And after the second and third apheresis it looked like this. She had a completely new eye. And since then the eye has never been red again.
Fantastic.
With the therapeutic apheresis, with the toxopheresis, we were able to treat not only the neovascular AMD with the cystoid maculae, but we were able to observe a reduction of the druses, i.e. the waste packages, especially in the area of the retina. And we could also, and that was the decisive factor. This is another advantage of this therapy. By means of the apheresis, this also leads to the fact that these membranes, which have grown on the retina's surface, are pushed back to remission. So she didn't have gliosis anymore. And the resulting swelling of the macula has also decreased. The glaucoma she had, i.e. this eye pressure increase, we were able to eliminate with it. And now she only needs to take a medicine every 2 days. And this also has a stable eye pressure. The papillary bladder has gone back, because the microcirculation, of course, through the therapeutic apheresis and through further therapies, which we then added after the third apheresis, was significantly improved, so that the papillary wetness also went back and the situation of the dryness of the eyes could of course be improved, because the glands also produced better tear gas. What was also observed was that the blood pressure went back to normal limits, without needing therapy. She also doesn't take any blood pressure lowering drugs anymore, and her heart rhythm disorders, which she had, are no longer present and do not need to be treated medically. The fatigue syndrome went back, the patient is happy and has enough energy. The increase in the ADP could also be confirmed by a laboratory examination. We were also able to prove that the inflammatory parameters, which were significantly increased before the apheresis, were significantly reduced and were suppressed in the normal range.
I just have to end it now. Unfortunately, our time is up. But you have now presented this to us in a fantastic way, and I thank you for this great case, where hopefully there will be many more in your practice. You certainly have feedback on this from other patients, but as I said, we can have no more time for that.
We have a lot of interesting cases, but this was the most interesting, because after an apheresis, which we never observed, the macular edema immediately went back. This is nowhere in the literature described.
Fantastic. You may not necessarily expect this after every treatment, but basically it is also possible.
Exactly. We did not expect that either. Normally, this is a process where it slowly sets in and slowly limits. That it goes so promptly, of course, we were very surprised. That's why I wanted to present this case today and not another.
That was great. Thank you very much, Dr. Trapp.
Thank you very much.
It was very impressive. Congratulations on this beautiful success and good luck with the toxopheresis in your practice.
Thank you very much.
Thank you. We say goodbye on this path. Thank you very much.
Thank you.
As a group, we can only say that you have put a concept together. The company MedSelect offers a network where you can join and maintain a great exchange between physicians.
Yes, that is basically the cooperation between the individual physicians. To exchange in these areas, that is, to complement each other. And that is, of course, a great thing, as in this case with Dr. Trapp, to transfer this experience or the ophthalmology field to other practices.
And not just there.
In the end, to give patients the opportunity to get these offers within the entire group, in cooperation.
May I ask our viewers on TV where you can find information, where patients can go?
Generally on the MedSelect website, under www.med-select.de. There, patients can contact us. We then also contact the patients and show them which cooperation partners are working in this area, for example, for them in their environment.
Dr. Med Harald Burgard, you have not come that far. I'm sorry. But you are partners in this concept and you try. What does it mean, try, but you make it popular or make it known?
Yes, because you can achieve many things with it.
Right, not just in the eyes.
Eyes, energy, vessels and so on. We saw it nicely. For the patients, this is basically an all-rounder treatment that can be very helpful.
Wonderful, then I thank you. I am very happy to be able to announce something positive every now and then, compared to what we hear in the news every day. So that gives courage for many diseases, for many people who are healthily somewhere in front of a wall and where there are no other options. So there are always possibilities. Thank you very much for your doing, for your impact, for your idea and for your concept, and good luck with it.
Thank you.
See you next time.
Thank you.
Dear viewers, thank you very much for being there and for taking the time. And so, certainly, you agree with me, it was extraordinary. It was a spectacular case, and there can certainly be many such cases. And it is perhaps also hope for many people who are just looking for solutions here. So in this sense, stay vigilant and attentive and loving to yourself. And I look forward to seeing you again next time. Until then, goodbye.